Good morning or afternoon to everybody in attendance today. You are here for the myHRcounsel preparing for ACA season brush up on what's required, deadlines, and more. My name is Janelle Stanton. I am the Vice President of Communications here at myHRcounsel. I'm joined with our in-house ACA guru and Director of Content, Michael Johnson. We're going to be talking about, again, all things ACA related today. So thank you again for being with us. I do want to cover, before we get to the agenda, several housekeeping items for you guys, just real quickly before we jump in. So first of all, there is on the webinar window there, I have included a handout. It is the slide deck that we're going to be going through with you today. So if you want to pull that up and follow along or make notes as we go, that is available for you under the handouts tab there. A couple of other things. So this is episode 11 of our third Tuesday webinar. And next month, we already know that we've had several requests for this webinar to be presented. So mark down in your calendar, it's going to be on December 17th at 11 o'clock a.m. Central Time. We will be covering the new W-4 and the withholding requirements that are going to be changing for employers in 2020. We've had a lot of people very worried about / confused about, and I've seen some emails from other service providers out there that are, I think, doing a fair amount of fear-mongering, so we want to put you to ease, but tell you what the changes are going to be. So that's going to be on December 17th, talking about the new W-4 and withholding requirements for 2020. So I hope you can join us then for that presentation. So as we do with all of our webinars, we are recording today's presentation. We will be sending out a follow-up email to everyone in attendance, and sometimes it comes out, sometimes we're able to get it next day, sometimes it's second business day, depending on how long it takes us to upload our video. So sometimes the technology is slow, and we apologize for that, but you will get an email. In that email, you're going to see several links. So we get invariably an email after every time we send out this email saying, hey, where's the recording, link to the recording of the presentation. Everything I talk about is in that email. So scroll through it. Make sure you check your spam folder because sometimes things do go in there. I don't know why, but they do. So you'll get a recording of the presentation. You will get your HRCI credit code. So we did apply for 1 hour on the presentation today, so you will get the code for those of you that need HRCI accreditation. If we get any Q&A today from you guys, we will type that up and send that out along with everything else in that email. We also are going to include our survey, so we please urge you to take our survey. It lets us know how we're doing and also what topics you might like us to present on. So for next month, we had, like I said, several requests for information about the new W-4. So we try to tailor our presentations and content to what you guys are asking for. So please, if you have time, we will send out a link to the survey. And then we will also, I put together an infographic that has all of the ACA reporting best practices. So it's a list of all of the best practices for getting through the ACA season as quickly and hopefully painlessly as possible. And then stick around at the end of the presentation. I do have a little bit more information about another service that we have for you guys that we think is very, very helpful in getting you, again, through the reporting season. Just a couple more quick things. So just so you know, we do have a YouTube channel, and if you just search YouTube for myHRcounsel, all of our videos that we've previously recorded, so all of the past Third Tuesday webinars, we also last week did a California law update webinar, which was very heavily attended, and California law for employers is very complicated, so that recording is up, as well as we did a Minnesota wage theft presentation, so we do keep track and store all of our previous presentations there as well. And then for those of you that are clients of ours, we're really excited to tell you that we have launched our brand new mobile app. So you can actually take our attorneys with you on the go, and that is able to be downloaded from the App Store from Google Play. So watch your email if you're a client of ours. We're going to have an upcoming contest. We want you to show us where you take our lawyers. So it's going to be fun. Watch your email for that. So just, like I said, a couple of housekeeping items. As for the agenda for today, so we are going to be brushing up on the basics. I know that a lot of people, this isn't your first go-around, but there might be some that have just now become an ALE, an applicable large employer. So this is kind of new territory for you. We're going to talk about some of the changes in required reporting, changes in the 1095 form. We're going to talk about when should I start prepping and reviewing forms, what are the deadlines. We're going to talk about some case studies, and then we're going to talk about the future of the ACA. So we've got a lot of stuff to cover here, but stick with us. I think that the information will be very beneficial. So as always, when I'm getting started with a presentation, I like to do just a little bit of background. So I want to, again, brushing up on the basics, or at least, or maybe for some of you learning the basics here. We use a lot of acronyms in this presentation, just starting with ACA, of course, the Affordable Care Act, but we use a lot of acronyms, so we just want to make sure that you're aware of what all of those acronyms are. So when we talk about an ALE, that is an applicable large employer, and that is for the most basic definition of it, and I will get into the weeds a little bit on the next slide about ALEs, but an ALE is an employer employing 50 or more full-time, including full-time equivalent employees on average during the prior year. So people ask us a lot, well, I don't always have 50 employees. Well, that's okay. You average it out. If you're underneath it, you're not an ALE. If you're over it, you are. So you look at the average number of employees per month that are full-time working for your company in the prior year. Of course, for 2020, we'll be reporting on 2019. FTE, so I use the acronym, or is it an acronym? FTE? Acronym? Thank you. I'm trying to get the right word here. Full-time equivalent. So another thing that we get questioned on a lot of people are still under the assumption that a full-time employee for purposes of the ACA is only somebody who works 40 or more hours. For benefits and vacation and a host of other things, a full-time employee is somebody who works 40 hours or more. But for purposes of complying with the ACA, a full-time equivalent employee is somebody that averages at least 30 hours a week or 130 hours per month during the measurement period. And again, we'll be touching on what exactly is a measurement period in a coming slide, but just so you're aware of the FTE and what that is. We also will talk about MEC, and that is minimum essential coverage. So that is the minimum sort of level of coverage that an employer can offer and stay compliant with the ACA. Some of those examples include marketplace plans, so plans that are out there on the marketplace are going to comply with ACA. Most job-based plans, Medicare, Medicaid, CHIP, those types of things. We're also going to talk about minimum value, so that's MV, and minimum value, an employer-sponsored plan that provides MV, minimum value, if it covers at least 60% of the total allowed cost of benefits that are expected to be incurred under the plan. Oh my gosh, what does that mean? Yeah, minimum value, it has to just cover, like I said, at least 60% of that cost. And if you are not offering a plan that has minimum value, you are not complying with the ACA. And then this isn't an acronym, but I want to, affordable is not just a, oh, I think this is affordable in my opinion. Affordable has a specific numeric figure attached to it. So for tax year 2019, this was bumped up from a lower number from previously in 2018, but affordable is a job-based health plan covering only employee that costs 9.86% or less of the employee's household income, and that's what's considered affordable. So affordable, again, it is a specific mathematical figure attached to that. I think I did forget to mention too that there is the ability to submit questions if you have questions as we go. I do have a comment here from one person that the audio is not good. So is anybody else experiencing any issues with the audio? If you could please let me know. Sometimes it might be the way that you've decided to call in. If you've called in with your computer, for example, I know sometimes the audio isn't great. But if anybody else is having issues, please let me know. I can always try to call back in. So let me know if anybody else is having audio issues, please, or if you have questions as we go. All right, so again, jumping back into some of the basics here. So what I like to cover these, but as far as the purpose of the form is meant to report information to the IRS about offers of an enrollment and health insurance coverage. Unfortunately, for employers, it ends up being a way that you can sort of tattle on yourself, but that's what most reporting is allowing the government allowing us the opportunity to tattle on things that we haven't done properly. So Form 1094C reports the information about and offers of an enrollment and health coverage to the IRS, and Form 1095C reports that information to the employee. So that's the purpose of the form. As far as who must file, so we've already talked about ALE, an applicable large employer. So ALE members or employers with 50 or more full-time or full-time equivalent, i.e. 30 or more hours a week, 130 or more hours in a month, those are if you have that number of employees in the previous year, then you're going to be considered an ALE, and you're going to be required to offer the coverage and comply with all of the other requirements of the ACA. And this does include groups of employers that would be aggregated together. So the aggregation rules are fairly complicated as far as figuring out who is going to be considered an aggregated ALE. But I'm just going to give you a little bite here, and this is a great time if you have, if you're thinking through this process and you're wondering if you're an ALE and you want guidance from one of our attorneys. This is something that we advise on and will help you try to determine is whether you're an aggregated ALE. So companies that have a common owner or are otherwise related under some of the IRS code sections, they are combined and treated as a single employer for determining ALE status. So if there's three companies that are owned by, there are three subsidiary companies owned by the same main company, and each company has 25 employees in it, so there's 75 total, that's going to be considered an ALE for purposes of the ACA because there's common ownership. You put all of those companies together with the number of employees, and that's how you're going to be able to determine whether you're an aggregated ALE. So if that combined number of full-time employees and full-time equivalent employees for the group is large enough to meet the definition of ALE, 50, then each employer in that group is part of an ALE and is subject to the employer shared responsibility provisions, even if separately that employer would not have been considered an ALE. So you do have to put those numbers together. There is also some special rules for those that might have a self-insured plan. And so an ALE must report information about insured health plans on Form 1095C Part 3. So there's an additional part to that 1095C that if you're self-insured, you have to fill out. If you are a non-ALE, so you're under 50 employees, but you have a self-insured health plan, there's some different forms that you have to file, 1094B and 1095B. So again, there's a couple of different requirements there if you're self-insured. So again, just kind of high level, ALEs have to offer their full-time employees the opportunity to enroll in a health insurance plan that provides minimum essential coverage. If they don't, there may be subject to a shared responsibility payment. So that's one of the penalties that they're required to do. And so this reporting tells the IRS whether you've made the offers of coverage, whether it has minimum essential coverage, and if not, then you may be looking at one of those penalties, which we will dive into in a little while here. So, all right, so we do have a question here. How do you determine the household income? And so I'm assuming this is for purposes of calculating the 9.86%. And so I believe as far as the calculating the employee's household income, it's based on the taxable income for the year for the entire household. Is that correct, Michael?
Yeah, and then also the calculation involves looking at the percentage of affordability that the IRS has put out. Again, for tax year 2019, it's 9.86%. Once you have that information for an individual employee or for an individual plan, an employer then needs to go through and actually do that calculation to see if one of the affordability safe harbors applies. So it does relate to the household income of the employee and then run through the calculation.
Great, thank you. All right, so this is still part of my brushing up on the basics section, but I remember when I was first learning about the ACA from Michael and from reading a lot of material, wrapping my head around the measurement period, administrative period, and stability period was complicated. But it's still important to think about because this is from a plan design standpoint. You want to make sure that when you're going into the reporting season, you know what your specific plan's measurement periods, administrative periods, and stability periods are. Of course, the regulations state the measurement period is not less than 3, but not more than 12 consecutive calendar months that are chosen by the employer. Most employers are going to coordinate that measurement period with their annual benefit plan year, which makes just the most sense from an administrative standpoint. Typically, we see most of our clients doing 12-month measurement periods. If you hire on an employee and you don't know if that employee is going to be full-time or full-time equivalent, so maybe they're a variable hour employee, and so you're going to enforce a measurement period against that employee. You're going to track all of the hours that they work each month to see if they make it to being considered a full-time equivalent employee. If at the end of your measurement period, which again, usually people will do a 12-month measurement period, if they qualify as either full-time or full-time equivalent, then you're going to make an offer of coverage for them. You do have an administrative period that allows an employer up to 90 days to do that calculation of the hours worked over that measurement period to see whether they qualify. So then after that up to 90 days, you make the offer of coverage. The employee is free to accept or decline it. If they accept it, then the employee goes into the stability period. And so they need to have then that insurance for the full time of the stability period, and it has to match your measurement. So if your measurement period is 12 months, the stability period is 12 months. So if you made them get measured for 12 months, then you have to allow them to have coverage for the full 12 months to match that measurement period. And that's even if during the whole stability period, that employee never meets the full-time equivalent number of hours again. Of course, with an employee that you hire on that you know right off the bat that they're going to be full-time, they're hired to work 40 hours, so they're not a variable hour employee, then they can, you can go through the administrative period and have them wait out again up to 90 days, and then you make the offer of coverage, and then they're insured. So, but again, this is something that you want to be thinking about well in advance and should have as part of your plan design. Anybody that is going to be assisting you with doing the ACA reporting is going to need to know that information to make sure your administrative periods are all lining up and everything is looking good with your offers of coverage and your timelines on that. So it's a complicated sort of idea, but once you kind of get into the practice of it and you have a method, a measurement period, and all of, administrative period that you're applying equally, it does become much easier and sort of institutional knowledge at that point. All right, so a couple of, how do you collect the income from other members of the household? So this is, again, talking about the question about affordability and that 9.86%. So the question is, how do you know what the income is from the other members of the household for calculating affordability?
And sometimes that's the risk with some of the affordability safe harbors, is that you may not know that information until after a full tax year has gone through. So we're going to talk about this a little bit more later on in the presentation, but it's very important on the front side for an employer with their plan design team at the employer to work with your insurance broker to get a lot of these issues ironed out on the front side in terms of getting compliant coverage. That's MAC, MV, whether or not it's offered to spouses and dependents. And with your broker and your plan design, that's a good way to figure out if one of the safe harbor codes, which we will talk about for affordability, is going to apply to your plan. It really does come down to a lot of coordination with the broker and the employer on the individual plan.
Yes. Thank you. All right, and I have other questions here, all relating around determining household income, but again, as Michael pointed out, that is something that you would need to work with your broker on to make sure that the plan that you're designing is within those affordability realms. So it's not something you would just sit at your computer. Oh, I think her husband makes a lot of money, so their percentage would be the 9.86%, would be this. You're not doing a finger to the wind sort of guesstimating what somebody, single makes versus somebody with a spouse that has a great job. We're not saying that that's how you make the calculation. It's something you're doing in conjunction with your broker.
Yeah, it really does come down to a plan design analysis that fits over the entire plan for all employees when you're looking at an affordability calculation. It really is done with the insurance carrier or broker to make sure that you're getting a compliant plan. That's one thing that as an employer, you can shift that responsibility onto your broker or insurer directly to make sure that they're working with you to get you a compliant plan for what your employee demographics are in terms of income.
Yep, perfect. All right, so moving on, with the presidential and congressional shifts, there have been also some new shifts in things that, around the ACA, with, I think, the biggest one and what most people are familiar with is that the individual mandate penalty was reduced to 0. So for those employees that are not covered by health insurance, they declined it. They didn't go out to the marketplace. They think they're young and healthy and there's never going to ever be any issues with their health such that they would need insurance. Previously, employees that didn't have coverage would have faced a penalty for not having health insurance, and they had to pay that out individually, and now that's gone bye-bye. So when the individual mandate went bye-bye, I think a lot of employers thought, oh, great, well, so is the ACA reporting requirements, and unfortunately, that is not the case. That is not what has happened here. So Good news for the individual taxpayers, I suppose. I still think they should people should have insurance, but you know, not so not relaxing of the rules for employers, I would say. So we got a lot of questions after that was repealed if that meant reporting was going away, and it is not. For the 2019 filing season, again, though, the IRS will not accept electronically filed tax returns where the taxpayer does not address the health coverage requirements of the ACA. So the taxpayer still has to indicate whether they had coverage, if they had an exemption for why they weren't covered, or will they make a shared responsibility payment. So at this point, again, the penalty is zero, but they are still going to need to address whether or indicate whether they had health insurance coverage there. So just a couple of minor sort of change. That's kind of a minor change, but.
And a good way to look at that is to just keep in mind that as an employer, you're still required to report to your employees if they're eligible for an offer of coverage using the 1095-C form. The employees, however, they're not going to be penalized, as Janelle just mentioned, if they don't have coverage, but they need to indicate on their tax returns. And the most important takeaway is that the employers are still on the hook for reporting, and they're still on the hook if they do not offer coverage as required under the law.
Yeah, perfect. Thank you. All right, so as far as changes to the 1095 forms, so the IRS did release a draft of the employer instructions on November 13th, 2019. I combed through that pretty thoroughly. It seems that most things have remained the same. I mean, the affordability calculation went up this year. The penalty amounts went up this year. Of course, as those always do, but as far as what I can tell from the instructions, which again are released only in draft form, it doesn't look like there's been much of a change with the 1095 forms. Based on prior years, really nothing changed in prior years either. So I don't anticipate changes, but we never know. So at this point, the 2019 form doesn't appear to have been approved yet. So we can't preemptively file. We can't really do any of those things. We could still be doing all of our monthly tracking and gathering all of the data that we recommend doing based on our best practices checklist that you'll be getting. But at this point, stay tuned on the 1095 forms. I don't see any changes being made, but we never know. IRS likes to change things at the last minute, and one of those things that they always like to change on us is deadlines. And now we've had extensions on the deadlines. Who knows this year if we'll get an extension or not? We're on year 4 of reporting. Is it 4th year? 16?
Yeah, and the issue is that, as people who are listening know, is that when there are changes or extensions made to the deadlines, they always come in late December. Yeah. Typically, it's the week between Christmas and New Year's, or in that neighborhood. So we advise, and Janelle's going to talk about this, to just plan to adhere to the deadlines that she'll discuss right now.
Yeah, the IRS they like to hold the ball. And they like to let people know when they're, distracted from the holidays. But so at this point, 2019 reporting happens in 2020. So it's not a typo there. But 1095Cs, they need to be provided to employees by January 31st, 2020. So that's the date that employees need to be receiving their 1095C by. There's 2 different dates for transmitting that 1094C, which is the document that goes to the IRS. That can be done by February 28th, 2024 paper filings. Although, just FYI, if you are an ALE and you have more than 250 1095s, you do need to use electronic filing. and you get an extra month on that anyway, so you get till March 31st, 2020 for e-filing. So again, possible extension, no guarantee. Plan now to meet the existing guidelines that you've got here. And, you know, the handy calculator, or calendar, sorry. All right, so I'm going to touch on a little bit of background about the penalties, and then Michael is going to talk about some of the case studies that we have actually handled in-house. So there's a couple of different types of penalties that can be assessed against a company for various ACA violations. The first one is the A penalty, and that's under Internal Revenue Code section 4980H(a), which is why we call it the A penalty. With an A penalty, if an ALE does not offer coverage or offers coverage to less than 95, if an ALE does not offer minimum essential coverage, MEC, to at least 95% of its full-time employees or full-time equivalents and their dependents, and at least one full-time equivalent employee was allowed the premium tax credit, so they went out on the marketplace and they got the premium tax credit, they can be subject to an A penalty. If the ALE did offer MEC to a minimum essential coverage to at least 95% of its full-time employees, and at least one full-time employee was allowed the premium tax credit because they went out to the marketplace and they got the premium tax credit, and they did that because the coverage the employer offered was unaffordable, it did not provide minimum value, or the coverage was not offered to that full-time employee, then they can be subject to a B penalty. So that one is under IRC section 4980H(b). With the penalties, there's different ways that the monetary amounts are calculated. So for the A penalty, if you're subject to that, the penalty amounts are imputed to all full-time employees minus the first 30. And this is how these A penalties end up really skyrocketing. And you're going to see that on Michael's A penalty case analysis, because you'll see that it is imputed to all. So what they'll do is $2,500, that's new for 2019, divided by 12 times the number of full-time employees less 30. So that's how those penalties for a larger workforce get to be so crazy. And then for a B penalty, the amount of the penalty is $2,500 divided by 12 times the number of full-time employees who received a premium tax credit. So this one is for those employees that went out, got the tax credit, and they did that because the plan that the employer offered was not affordable, it didn't have minimum value, etc. So for all those reasons that I listed under the B penalty as why you may get one of those letters. So Michael will touch on this, but we've seen some penalties that, some under $10,000, but we've seen some that are over $7 million. The biggest one we heard of was $92 million for a huge staffing company. $92 million. I don't think that was the legislative intent of Congress to slam employers with these types of penalties, but the method they've used in assessing these penalties by imputing it to all employees has created some really panicked phone calls and emails and tickets to our attorneys when they see the letter that says, hey, you owe us $6 million for these penalties. It's a very unnerving experience. I'm sure it's not necessarily not unnerving for us too in helping our clients. So just an FYI, just why those penalties can end up skyrocketing so quickly. But I'm going to hand it over to Michael. He's going to talk to you guys about some of our different case studies.
Thanks, Janelle. And with myHRcounsel service, obviously you have access to attorneys, and with our affiliated law firm, we've actually addressed some of our clients penalty letters where they've specifically engaged us to do that service for them, and looked at and seen a lot of these letters. And as Janelle mentioned, the letter that comes from the IRS indicating a penalty to an employer is the 226J. And as employers out there listening, you may have heard of that, you may have read about it, you may have, maybe your organization has received one of those letters. And it is kind of an unnerving experience because generally the penalties are fairly high for any type of organization. They can even be kicked out by a small number of employees, which we'll talk about. So it is kind of an unnerving situation if you receive one of those letters. And if you do, you want to immediately talk to either us or talk to your tax preparer or somebody. You want to get some help with responding to that type of letter. So with the slide now, we've got a specific image that is actually a screen capture of a letter received by a client indicating an A penalty amount, as Janelle had just mentioned. And this is from an actual letter, again, from the IRS. But as you can see, if you look at column D, there was only one employee that triggered the IRS kicking out this penalty. So out of all the employees in the organization, as you can see, it's over 100. Only one person went out to the exchange. Only one person got a premium tax credit, and that person, because of that, kicked off a big penalty to the entire organization of $138,000. So, and as Janelle mentioned as well, that penalty is imputed to everybody in the organization. In this case, less 40. That was what the IRS deducted from their total amount. So you're looking at 106 employees basically for several months minus 40. So you're looking at roughly 66 employees for penalty calculating purposes based on the actions of one employee. Also, you should note quickly on column A, this is talking about the 1094 reporting, and it talks about how on Form 1094A, thank you, Janelle, the minimum essential coverage indicator on the second page of Form 1094, which is Part 3, column A, they had checked no in terms of whether or not they're offering minimum essential coverage to at least 95% of employees. That's something that, generally speaking, again, if you're working closely with your broker and you're looking and working with them not only on affordability but also on providing a compliant plan that's offered to enough of your employees to get you over the hump in terms of numbers, that's something that generally should be checked yes. So let's pay attention to that column A as we kind of go through this. And looking at the amount, again, $138,000, which is, looking at the column there, $11,000 basically per month because of the actions of one employee. So what happened with this case study? How were we able to assist this client? So the result on this one was actually quite favorable. Again, $138,000 penalty. We got it knocked down to zero. No penalty, $0. The reason that we were able to do that is this client, and Janelle's going to speak to this a little bit more, they had been tracking their offers of coverage, who's eligible, the number of employees, those sorts of things. They've been using an HCM or human capital management software platform that had an ACA module in it for tracking. And with backtracking, with talking to that client, we were able to figure out that the ALE did, in fact, offer coverage to the required number of employees. Again, that was at column A on the previous slide with that box that was checked no, that Janelle had circled. That should have been yes. So that's a big way to help reduce some of the penalties. And also, they were able to show secondarily that the one employee, again, remember that column of the employee that received the premium tax credit, that employee was, in fact, offered coverage, and they had a form, which we will discuss further, where the employee had waived coverage. So between those two factors where they were able to correct that, yes, they'd offered the proper amount of coverage to all the proper number of employees that they needed to, number one, and then number two, that that employee was, in fact, offered coverage but had declined, they were able to, with our assistance, go back to the IRS and say, this is why we don't owe a penalty. The IRS agreed, and that $138,000 was reduced to zero. So that is a very favorable outcome for an employer with that type of case. The other The other type of penalty that come up, as Janelle had mentioned, is the B penalty, and again, that's where there is an offer of coverage made, but it's not affordable. The employee, that specific employee that triggers a penalty, is not offered coverage. There's all those factors that apply. So this is actually a different case study that we received. So this now is noted here. This was for a B penalty. If you look at column E, the number of employees that were assessed for the penalty, you'll see that it was a fairly decent number of employees per month, as Janelle is circling that. This wasn't just one employee. This was a pretty good number of employees. And with taking the calculation that she had discussed further or earlier in the presentation, where the amount of penalty is imputed out to all the FTEs at the organization, this company ended up with a assessed penalty from the IRS of over $36,000. I mean, that's a significant amount. Even sure, it's not as much as 138, but 36 is still a pretty big bite in terms of a penalty from the IRS. So what happened with this one? So with this particular penalty, we were able to assist the client and get it not eliminated, but reduced significantly from 36 grand down to $5,300. Now, the lesson here in this tracks a little bit with what we said before on the A penalty. So this employer was using manual ACA tracking. In other words, they had a spreadsheet. They were not using HCM software. They did not have an ACA module. They had to go back and recreate eligibility and coverage data for all those employees that they showed, and some of them it was up to 15, 16 employees per month. They had to go through that data line by line with each employee, month by month, to recreate what actually happened. Now, doing that was a lot of time, it was a lot of effort. It took people away at the organization from their normal function. So there's an opportunity cost to an employer when you have people working away on these types of projects. Boom, they spring up out of nowhere. It's a 5 or 6 or 7 figure penalty. It's all hands on deck to respond within the very short window that the IRS offers. So we were able to get a favorable outcome that the client was very happy with in terms of, yeah, we made a mistake for a few months, but it wasn't a $36,000 mistake. The system, if you're using an ACA module or an HCM system, it would have flagged all of this stuff on the front side prior to reporting. The client was very thankful for our help, but then they decided that they did not want to do this manual tracking anymore because it's potentially too error prone. Even if you have an excellent person doing it, the rules are so complex that a lot of times it works better, and it's an easier burden on the employer if they're using a system. Yeah.
And Michael and I are infinitely, unfortunately, familiar with those spreadsheets. Back in the old days of the ACA reporting, we combed those spreadsheets as well, and your eyes glaze over with visions of 1E and 2C, and it's really difficult. So, here's a plug now, and we'll give you a plug later, but using an automated HCM system or ACA module is going to, one, eliminate that human error from eyes going googly eye looking at rows and rows of spreadsheets, but also hopefully flagging issues so that before you're submitting those things to the IRS to tattle on yourself, you've discovered any mistakes that you may have made with those documents before the IRS does.
And it does help with your labor force efficiency, where you're not in a crisis mode 2 years later because you've got a letter and you're trying to forensically recreate your data if you're manually tracking.
Yeah.
So a lot of people have asked, and Janelle touched on this as well, with the political season already in full swing yet again, it seems like we just went through a couple of these. What's the future of the ACA? There was talk in the last national election campaign 3 years ago about the ACA. The talk has been going on since then, and it will likely continue into the new election season. There are some kind of things that have happened. There are some things in the background that we think are worth mentioning. It may not be the main item in the news cycle right now, but it's something as an employer you definitely want to keep your eyes and ears open. Look for our updates that we send out on these types of topics. So one of the big things that's happening right now is a case called Texas versus the United States. And this is an ongoing lawsuit filed down in the southern part of the country in the Fifth Circuit Court of Appeals. That's a U.S. federal court where 18 state attorneys general had brought a case where they are asking a federal court to basically strike down the ACA, in that once the individual mandate was removed, that the law, the leg that the law stood on is no longer there. That is their argument. The Fifth Circuit initially agreed, the district court, but now it's been kicked up to the Federal Court of Appeals, where they are looking at it. As of today, I looked this morning, there's not been a decision made yet, but basically the lawsuit is significant in that it challenges the entire foundation of the law, and they're saying the whole law should be knocked out. In opposition to that position, a number of other states have attorneys general that have filed motions or briefs that saying, no, it has to stay. And so now a circuit court of appeals is reviewing that. Whatever that circuit decides, you can know for sure that whoever loses, quote unquote, at that level is going to certainly appeal to the U.S. Supreme Court. Our experience lets us think that the U.S. Supreme Court will probably take that up, because it is a significant issue. How it would be decided, we don't know. When any of that is going to happen, we're not sure, but we just wanted to put that on your radar as a very significant issue that's hanging around in the background out there regarding the law. But in the meantime, nothing has changed. Our advice is to definitely continue with ACA compliance and planning as you've been doing. Another couple of things that have happened with the ACA involve some rule changes, and we're just going to kind of touch on these briefly, not to get too deeply in the weeds, but it's something that some employers want to know about and they want to take advantage of. Again, if you're going to go down these roads, they're newer avenues. You want to have, you may have questions, you want to work with your benefits broker, or if you have legal questions, that's something that, if you're a myHRcounsel client, we can also assist you with. But one of the things that has now been brought under the umbrella for use in the ACA is what's called short-term limited duration insurance, or STLDI. It's another method for an employer to provide compliant coverage to employees. So instead of an employee that would be uninsured, it would let somebody instead an option to either pay the ACA plan premiums or buy into the STLDI market. And what that allows for is you can get a shorter term policy. You can get a policy with an initial maximum term of 12 months plus 2 renewal periods of 12 months. So a person could actually, instead of being uninsured, they could get on some kind of coverage. It's probably a little bit lower cost for 36 months. This rule is out there. However, as with all things related to the ACA, it's been challenged. So there are some people that really like it and they proposed it, and there are some people that don't like it, they're opposing it. This rule is still in the court system, but it's something to keep an eye on as an option as an employer. The other change that has happened are a couple of health retirement account expansions. And just as a quick refresher, an HRA or health retirement or health reimbursement arrangement, it's an employer-funded group health plan from which employees are reimbursed tax-free for qualified medical expenses up to a fixed dollar amount per year. The rules allow unused amounts to be rolled over into subsequent years. The arrangement is employer-funded, and they're sometimes also known, so it's either health reimbursement arrangement or health reimbursement account. So the IRS and the DOL and the U.S. Department of Health and Human Services have looked at this option in terms of employers helping employees with coverage costs, trying to get more access to coverage for employees, and they issued new regulations this year expanding opportunities for employers of all sizes to use 2 new types of HRAs. We'll just talk about these briefly again. We don't want to get too far in the weeds, but we do want to put them on your radar as an option, and again, that would be in conjunction with planning with your benefits person, your broker, your insurance carrier, those sorts of people. So the first one is an individual health coverage IRA, otherwise known as an ICHRA, and that has employers being allowed to reimburse employees for premium expenses incurred by the employee for individual health insurance that complies with the ACA's market rules. So again, you get a reimbursement from your employer for a market qualifying plan. But the caveat with an ICHRA is that employers can't offer that same employee or group of employees both an ICHRA and a traditional group health plan that would comply. It has to be one or the other. If you're going to use that method, you have to either offer the employee or group of employees either the ICHRA or your regular group health insurance plan, one or the other. The second type is called an EBRA. That's an accepted benefit HRA. And that permits employers who offer traditional group health plans the ability to reimburse employees for certain qualified medical expenses, including premiums for vision, dental, and even in some cases the ST LDI insurance that we just talked about. Employer reimbursements can be up to $1,800 a year. Again, that's a very benefit-specific and plan design-specific thing to work with an insurer or broker. But both of those rules show kind of a relaxing of the ACA standards in the last couple of years. Another area that we want to look at is there's been some push to reduce some of the regulations, and I'll just kind of briefly go through these as higher level points. If people had specific questions, you could let us know. But some of the proposed reductions in regulations include relaxing some non-discrimination rules, including language access. That goes to maybe people that are hearing impaired. Under the current rules, there are very specific ways that a hearing impaired person needs to be able to access questions about coverage. Some of that would be relaxed. Same with video interpretation. Some of the coverage requirements, they're talking about some services may or may not be covered any longer that are currently mandated. I mean, the current law mandates a hugely broad swath of types of insurance coverage. Maybe all those would be, some of them would be exempted, or the rules would follow whichever state you're in. Also, there is a heavy, burdensome administrative process that adds to the cost regarding grievances. You would not necessarily need to have what's called a grievance coordinator under the law, which increases burdens on employers. So that type of deregulation is basically favored by one side of the political aisle. We won't get into specifics. I'll let you guess on that. The flip side of that, however, and especially in a presidential season, is some of the proposed ACA replacements or additions. And these are terms we've all heard about in the news. And one would be what's known either as Medicare for all or single payer. That's proposed by several candidates who are currently running for president. It would be a full replacement of the ACA, and basically it would take out all private insurance and move everything to a single government-run plan. It would cover health, dental, vision. There would be no longer any at all private health insurance for health, vision, dental. In fact, they would be illegal by law. It would be a 100% government plan. Another choice that's been thrown out is called Medicare X Choice. This would, instead of replacing the ACA, it would build on it. It would provide a broader Medicare option to employees to choose, and the plans that are the Medicare plans that would be developed would have to meet ACA requirements. And another requirement that's being pitched is Medicare at 50. That's also supported by several other candidates that are currently running for president on one side. It would again supplement the ACA, not replace it, and it would allow people between the ages of 50 and 64 to quote-unquote buy into Medicare before reaching 65. Again, an expansion of Medicare. Just keep an eye on this stuff. Keep your ears open. Look at our updates. We're in an election cycle. You'll hear more about this.
Yeah. And in fact, endless amounts about it. I'm sure. So I do want to point out one quick thing, and I'm going to show you guys the infographic that I created that you're going to be receiving. But so we got about 7 minutes here left. I think we're going to get done and wrap up a little bit early. We're wordy. We're lawyers, so it's a mini miracle. But one thing, so we've kind of hammered this point a few different times, but if you don't already have a software partner that you're working with to help you with the ACA reporting, tracking, all of those things, we partner with a company called SyncStream Solutions. They're fabulous. Their software developer is an attorney, and his name is Arthur Taquino. If you notice, he's in a lot of published articles about the ACA and updates. They're absolute knowledge and thought leaders in the market for ACA compliance. They also have EEO1 compliance, but we're talking about ACA today. Also, if you are faced with a 226J penalty letter and you're a client of ours, we ask that you work with SyncStream to purchase their audit tool. So they have an audit tool where they will do the forensic analysis of your data to figure out where the issue is that is causing you to get one of these A or B penalty letters, and will help us forensically put together the data and get a response drafted to that 226J letter much more quickly, efficiently, and so we do offer that service as well. If you are in the market and you're looking for a solution, SingStream they're great. So we recommend that you contact Sean Cooper. I put his email address there. If you do mention myHRcounsel, you do receive a discounted and preferred pricing. So another benefit to that. So I just want to show you here quickly. We did put together an ACA reporting best practices document here. So I'm just going to show it to you really quickly, and then we'll wrap up. But so we go through all of the steps, gathering plan information. So make sure you have information about the plan year start and end date, the waiting period. Know if you offered minimum essential coverage and minimum value. Ensure you offered it to spouses and dependents as applicable. Maintain information about the lowest cost for self-only premium, because that is line 15.
Yes.
In the form, that has to go in there. Know about your plan design, so the measurement method. So whether you do a monthly or a look back. Again, hopefully you're doing a look back from an administrative standpoint, but know what your measurement, administrative, and stability periods are. Keep them consistent. Do your monthly tracking. So this is where we, again, recommend having some type of system to help you keep track of this. You don't want to have to go back at the end of the year and try to remember, did we offer John Doe coverage in July or was that in August? And you don't want to have to go back and recreate and guess at those things. So,
or 3 years later, in some cases, the IRS is very delayed in their penalty letter.
Or 3 years later, when John Doe left a year prior. So make sure you're tracking the hours that are worked, especially if they're not full-time equivalent, and so you're having to track if they worked the 30 hours or the 130 hours. Track when you made offers of coverage. So another thing to keep track of. Again, when did you make that offer? Track whether they enrolled in the minimum essential coverage that you offered. Similarly, track when an employee declines coverage. We recommend using a form, a uniform document that you use each time an employee declines coverage, because if you get one of those letters that says, hey, you didn't offer John Doe insurance coverage, so he went out to the marketplace and he got a premium tax credit and now you have to pay, you can say, no, John Doe, he signed this thing. We offered him the coverage. He declined it. Hugely important for defending those 226J penalty letters. And then last but not least, and certainly not least complicated, are there safe harbors that apply? So determining safe harbors that may apply to your company's plan. The W-2 safe harbor, the
federal poverty line, and
poverty line, yep, and rate of pay.
Those are the three affordability safe harbors. There are other ones that also may apply, but the affordability ones are the most useful in many cases for employers, and they also can be complex, as Janelle and I have both spoken about, and that's where you want to get on the front side with your insurer or broker or with your plan design to ensure that you've got a compliant plan from them with affordability built in. Again, also, using an HCM platform or an ACA tracking module can help with that as well.
Yeah. And I do have a question here about a different partner of ours. So we have the iSolved HCM, so I presume it is captured for us. I don't know what it is captured. I don't know what you're referring to, but we have seen the iSolved HCM system. It is very comprehensive. If you are at all concerned about whether your HCM properly is capturing everything that you need to track for ACA purposes, I would definitely recommend reaching out to your partner, whoever you're working with at iSolved, to verify that. So I don't have any other questions here at the moment. Does anybody else have any last lingering, burning questions? You can also definitely feel free to email us or let us know if you have questions you don't want to ask them here. We totally understand that. Sometimes that does happen. So also, if you want help reaching out to SingStream or you have questions about their services, We are very knowledgeable and up to speed because, like I said, we partner with them. They do our ACA reporting as well. So they're a great resource. And what does HCM stand for? Great question. HCM, we use lots of acronyms, sometimes without realizing. It's a human capital management. So it's software systems, where you're tracking onboarding processes and
some include payroll modules.
Payroll, yes.
Some include benefits modules. Some include specific ACA modules. But HCM is just a broad term for human capital management. Another word for HR software.
Yep. Good question. Sorry for throwing out acronyms there. Okay, well, we're right at noon, so I'm going to end the presentation. Again, if there's any questions, please let us know. We will be getting out that follow-up email with all of the content I discussed at the very beginning. Thank you for joining us today. We really appreciate you guys and having you guys with us for this hour. Have a great afternoon.
Thanks, everyone.